speak about injection therapy of eye bags and dark circles, which include my concept of tired eyes. This is eye bags, eye dark circles, drop in upper eyelid and teardrop. Look at these eyes. All of them are tired eyes. And look at these patients. These patients are of all different age groups, but all of them have tired eyes. What about eye bags and eye dark circles? What necessary? It's necessary to normalize lymphatic drainage and improve microcirculation of the periorbital zone and reduce pigmentation, which creates the effect of shadow. And when we work with eye bags and when we work with eye dark circles, I use injections of lymphatic drainage products. They could be different, and they could be used in lymphatic drainage technique. And when we have eye bags and eye dark circles, we combine technique. We can use micropupils technique and lymphatic drainage technique at one procedure. And more often for my patients for lymphatic drainage, I use product with sodium succinate. Also, we can use mesotherapy products or peptides. It's not very important, but we need to use special technique. And for example, when we can work with succinate, why it does work? Because our tissues has a specific succinate-dependent receptor, GPR91. This is a very difficult structure in our membranes. This is membrane G protein, which consists of different components. And those receptors are presented in different tissues of human body, such as fat, platelets, liver, kidney, heart, brain. But for what is for us? For us, very important that those GPR91 receptors contains in smooth muscle cells of blood and lymphatic vessels. And what is it? Sodium succinate activates GPR91. Interstitial fluid go into vessels because receptors are activated and vessels come in tone. And after that, tissue swelling decreases. And normalization of lymph drainage and restoration of microcirculation is in the skin is the main stage of correction at tired eyes. So injection should be performed along the left from the upper and lower eyelids to the preauricularis, parotid, and supraclavicularis lymph nodes. And we need 2 or 3 procedures are required, and this procedure need to make lymphatic drainage. Also, which help with what problem can help sodium succinate normalize microcirculation, yes, and also activate Krebs cycles. We know that Krebs cycles, this is a component of a chemical reaction which can produce energy, and we normalize energy deficit and remove energy deficiency fibroblasts. And also sodium succinate have slight whitening effect by inhibiting tyrosinase, and we see slight effect of eye dark circle. And what about the next session? The next session, when we have drop in upper eyelid, the second session of correction is injection of small doses of botulinum toxin in the musculus orbicularis oculi to leave the upper eyelid and create the effect of open eye. A previous speaker, Dr. Olga Zabninkova, had amazing report about open eye technique, and we see many clinical cases of this technique and see many good results. And what about injections of lower part of this muscle. When we have, for example, eye back, this injection in the lower part of musculus orbicularis oculi muscle may contribute to increase swelling of lower eyelid, and we don't get a good result. And what about tear trough? You see a young lady with tight eyes. She is healthy, but she has a very strong tear trough. Lower eyelid is corrected with small amount of hyaluronic acid filler, but this is done to straighten the orbicularis retaining ligament and minimize eye duct circle. But we use only hyaluronic acid filler with non-hydrophilic characteristic, because if we choose, for example, don't right level of injection, we can get swelling and puffiness. The upper eyelid is also adjusted by the filler to elevate the upper eyebrow and disclose the lateral part of the eye. We can see this young lady with this effect with small doses of botulinum, with small doses of hyaluronic acid filler above the eyebrow. Subcutaneous injections of filler can contribute to aggravation of eye bags and swelling. And when we work with patient with eye bags, we need to remember it. And of course, this patient is a patient for plastic surgeon. But she's very afraid of operation of plastic surgeons and all kind of this procedure. So we use concept of tired eyes, and look, it's important to pay attention of the temporal zone, because temporal zone is static continuous of periorbital zone, and we work with all this zone of the face. Look at this young lady. We work only with periorbital zone, but after the course of procedure, we see how changed her face, and we can imagine that her face more slimmer, more. She look beautiful, and she look really restful and very attractive face. So look at this young lady. This is very young lady. He is 24 years old, and she is healthy. She is nice girl, but she has very tired eyes, yes, and specific. Pigmentation, and we work with her only one session, and we get amazing results and very beautiful and attractive face. And what about complications, especially when we work with subcutaneous injections of hyaluronic acid filler? Look at this patient when eye duct circles transform into eye bags, because it's wrong level of injections, and injections should be performed under the skin. No, we need to work under the muscle. So one problem transformed into another problem, yes, and now we need to work with eye bags. For previous, we need to work with eye duct circle. An extra step of correction is threads implantation, especially in aged patients or in heavy tissue. Of course, this lady is also true plastic surgeon patient, but the same reason she is afraid of plastic surgeon and operations. And what can we do with these patients? To lymphatic drainage procedure with sodium succinate. After this, botulinum toxin in upper lateral part of musculus orbicularis oculi, 50 units of G-spot, but we can use another products such as botoxiamine and other products of botulinum toxin. It doesn't depend of kind of product. Hyaluronic acid filler for elevation upper eyelid, 1 milliliter, and all also adjusted in temporal zone. And after that, threads for elevation eyebrow, 3 threads for each side. And so we get open here upper eyelid and nice, more attractive eyes. Look at these patients before the beginning of my presentation and the end of my presentation. We work only with periorbital zone, and we can see how change the face. The overall aesthetic patient portrait before and after periorbital zone correction. And when we work with patient, we need to pay our attention, especially of periorbital zone, because when we see patient, we see her eyes. Yes, the first step. And sometimes correction only of periorbital zone can make amazing results. Thank you for your attention. I wish you good practice, good luck. Thank you.